الجزيل على حضوركم هذا المؤتمر المتميز الذي تعقده الشبكة الشرق أوسطية للصحة المجتمعية بالتعاون والتنسيق مع جمعية الصحة العامة الأردنية ووزارة الصحة الأردنية. أيها الحفل الكريم، إن النهضة الطبية المتميزة التي حظي بها الأردن هي بفضل وفرة العقول النيرة وسياسة الانفتاح على العالم أجمع. والطبيب الأردني كما تعلمون دائم البحث عن المعلومة الطبية وعن كل ما هو جديد في عالم الطب عبر المؤتمرات الطبية والورش العلمية والدورات التدريبية المستمرة والمتكررة على مدار العام، وبدعم من نقابة الأطباء والجمعيات العالمية والمحلية على المستوى الوطني. أضف إلى ذلك إلى سياسة الأردن في استقطاب كل ما هو حديث ومتطور من الأجهزة والمعدات الطبية. كل هذا أدى إلى تقدم طبي كبير شهده الأردن في هذه الأيام. أيها الزميلات والزملاء الضيوف الكرام، يعتبر الأردن من أكثر الدول العربية والشرق أوسطية استضافة للمؤتمرات الطبية المتخصصة، والتي يشارك فيها نخبة كبيرة من الخبراء والمستشارين والباحثين على المستويات المحلية والعربية والإقليمية والدولية لمتابعة أحدث ما توصلت إليه الرعاية الصحية الأولية والطب العلاجي والطب التأهيلي بمختلف تخصصاتها. الحضور الكرام، لقد جاء هذا المؤتمر الكبير لترسيخ مبدأ التعاون وخلق نوعاً من التواصل مع الجمعيات العالمية والعربية للصحة العامة لتعزيز مفهوم الارتقاء بصحة المجتمع، والتي تعود بالنفع على صحة المجتمعات ورفاهيتها. وكلنا أمل أن يزداد ويتعزز التعاون والانفتاح بين المؤسسات والمنظمات المختلفة لتعميم الفائدة العلمية بين أعضاء الجسم الطبي الكبير، ولضمان ترسيخ أهداف التعليم الطبي المستمر. ولا ننسى هنا دور المنظمات الدولية والمحلية في دعمها المستمر لهذه الأنشطة. وختاماً، أسأل الله العلي القدير أن يكلل أعمال هذا المؤتمر بالنجاح، وأن يبارك جهود كل القائمين والعاملين على رعاية هذا المؤتمر لما قدموه ويقدموه للمشاركين ولمهنة الطب والرعاية الصحية على وجه الخصوص بالخير والنفع، متمنياً لضيوف الأردن الكرام المشاركين في هذا المؤتمر الطبي طيب الإقامة في ثغر الأردن الباسل مدينة العقبة. والسلام عليكم ورحمة الله وبركاته.
Thank you, Dr. Hijawi. The Training Programs in Epidemiology and Public Health Interventions Network, EMPHNET, is the global network for 55 field epidemiology training programs. It is devoted to improving people's health by training field epidemiologists and providing public health services internationally. Currently, the director of EMPHNET is an associate professor at the Complutense University of Madrid and has extensive experience in field investigation. Please put your hands together for Dr. Dionisio Herrera.
Assalamu alaikum. Thank you, everyone. It's really a big honor for me to be a part of this opening ceremony of the EMPHNET conference. First, I'd like to say thank you to the distinguished representative of the Minister of Health, Mr. Excellent His Minister. I'd like to say thank you to the Dr. Mohamed for inviting me and the representation of the EMPHNET, the member of the Minister of Health of Jordan, the Army, and the different persons that participate in this successful conference. These events strengthen the network of common interest, which is the one of the principal core element of the EMPHNET organization. As you know, EMPHNET is the network of field epidemiology training programs around the world, and we are 63 program family members that today we feel renovate and our responsibility to continue the improving of our activity and work together for the sustainability of the network and development of the field epidemiology training program. We are now more than 10,000 people already training in field epidemiologists around the world, and it's significant the number of these people training in this region. Our objective never ends of the strengthening of international public health capacity through the support of the field epidemiology training program in applied epidemiology. I am sure with the successful result in this conference, and I am totally confident in the quality of the presentation and the level of discussion we are expecting these 3 days. Also, I am very pleased with the extraordinary support and good preparation of the EMPHNET team for this conference and the extraordinary support of the field epidemiology training programs in this region. I like to recognize also in this ceremony the extraordinary support we have received, EMPHNET and TEPHNET as a network, as a brothers organization from the CDC, from the Center for Control Prevention, in the support of the activity of the field epidemiology. And also, I would like to recognize, because it's most important, the support of the Minister of Health of the different countries and principal for the field epidemiology. On behalf of the TEPHNET Secretariat and the TEPHNET Advisory Board, I would like also to say thank you for all of the people to be agreed to work as a voluntary role in the different committee and activity in the preparation of this conference. I recognize its extraordinary value, all of the support for everyone in this conference. I consider the principal topic of this regional conference, the public health challenge and opportunity, is a real element to use as a reference in each of our discussions and work together until the end of this conference. We have better friends, better relationship, but most important, better opportunity to collaborate together in the improvement of the field epidemiology in our region. Thank you very much for this opportunity. Thank you.
Thank you, Dr. Herrera Gubera. Prevent, detect, and respond. These are the 3 driving concepts of the U.S. Centers for Disease Control and Prevention, CDC, and are the basis for global health security. CDC continuously works with EMPHNET to promote safe world by working to prevent, detect, and respond to infectious disease outbreaks and other threats. Fortunately, we have a special guest speaker from CDC who has always been passionate about global health issues. We have the Principal Deputy Director of the Division of Global Health Protection. I'm glad to welcome Dr. Kashif Ijaz.
Assalamu alaikum. It's a great honor and a privilege to be here amongst friends and a very distinguished panel of experts. I want to congratulate EMPHNET for putting together this conference, and I also want to congratulate Aqaba as well as the Ministry of Health for hosting this very nice and prestigious conference today. Because field epi training program is one of the core activities that is done in public health in order to train the workforce that actually helps to prevent, detect, and respond, which I'll be talking to you in the next about 10 or 15 minutes. So I will also briefly describe why it's important to actually be thinking about global health security agenda and the role that the field epi training program can actually play in the global health security agenda, or actually it does already play. I will also describe a few examples, recent examples, where the field epi training program has actually been front and center in helping with the response to infectious disease events like Ebola, as well as with polio eradication efforts around the world. So, okay, so this slide basically shows that as a health threat anywhere is a health threat everywhere. So new viral and bacterial pathogens will continue to emerge, and today's world of increasing interconnectivity and mobility accelerates the shared global risk. Global transportation and commercial air travel is expanding not only from east to west, but also from north to south, linking emerging markets to the rest of the world more seamlessly than ever. And with this increased connectivity and mobility comes the increased risk of infectious disease spread, with the next outbreak only a plane away. So we have seen over time that global health risks have increased through the emergence of new organisms, drug resistance, and as well as intentional events. HIV raged undetected for a decade, and then severe acute respiratory syndrome, or SARS, it spread to about 37 countries across 3 continents in only a matter of 4 months. The international health regulations were revised in 2005, and they cover all the events, and since the time that it was revised, WHO has formally declared a total of 3 public health emergencies of international concern, which were H1N1, or influenza pandemic in 2000, the reemergence of wild polio virus in 2014, and more recently, the West Africa Ebola epidemic, which started in 2014. Now, when you think about all these infectious disease events that have occurred over time, you also cannot undermine the MERS, or Middle East Respiratory Syndrome, which we are all dealing with this in this region, and which has actually also spread, just like I showed in the very first slide, to other countries around the globe. So when you think about it, since the Ebola outbreak started in March of 2014, there have still been numerous other infectious disease outbreaks in the world. Here you see the outbreaks which have been reported by our Global Disease Detection Operations Center. There were a total of about 140 outbreaks occurring in 107 countries since March of 2014. So as Ebola outbreak or epidemic was going on, there were a lot more other outbreaks which were going around the globe as well. While some of these outbreaks remain small, there are others like MERS, cholera, as well as chikungunya, which spread throughout the region as well as the world. So this brings us to the question, why should we be thinking about global health security now? Today, most of the world is not prepared to address the public health events. When countries committed to the international health regulations in 2005, all the WHO member countries, about 194 of them, basically committed to it. And the first target date for reaching its goals, which all these countries were supposed to have met the requirements for international health regulations, was set for 2012. Unfortunately, by that date, only fewer than 1 in 5 countries, or about 20%, had met the international health regulation goals. After that, a 2-year extension was granted, and since in 2014, only about 64 countries reported achieving these core capacities. So there's still only 1/3 of the countries in the world which actually have basically identified themselves to be prepared. This lack of preparedness increases the likelihood that the diseases will spread across the countries, within the countries, as well as outside their borders. The human cost and economic cost of epidemics are large. For instance, like SARS basically cost around $40 billion, and in terms of the human cost, about 800 lives. And now with Ebola, there's more than 11,000 deaths and billions of dollars. So this brings us to the Global Health Security Agenda. Now this is an agenda which goes, it truly is a global health security agenda. It's a global agenda. It's not a US government agenda. It is an agenda where a lot of countries around the globe have basically, joined together. And this is an agenda which goes further than any other prior global coordination around multiple diseases and conditions. It is not another single disease initiative. It drives a set of concrete and achievable actions to help actualize the international health regulations. It helps us reach public health goals through prevention of avoidable catastrophes, detecting threats earlier, and being able to respond rapidly and effectively. So when you think about international health regulations, there are regulations and there are things that need to be achieved. And over time, the countries have not been able to achieve those. And then there have been numerous meetings where the countries have actually gone ahead and said, well, we need help in surveillance, or we need help in workforce development. And unfortunately, there have not been a lot of resources for the other countries to help them. Global Health Security Agenda basically also provides some resources where the countries can actually help each other in basically achieving the international health regulations. So the international health regulations basically has, the Global Health Security Agenda has 11 action packages. And I'm not going to go through all of them. CDC supports all the 11 action packages. So there are certain action packages which actually some of the other agencies and organizations might, like food and organizations that deal with Food and Drug Administration, they actually deal with it. But in terms of CDC, there are these 4 fundamental ones, which are laboratory, surveillance, emergency operations, and workforce development. This is, as I was mentioning, the most important thing about Global Health Security Agenda is that it actually gives you metrics in order to achieve these action packages. So when you talk about laboratory, for instance, one of the metric is to have a system where the specimen referral networking reaches about greater than 80% of the districts in a country. Similarly, for emergency operation centers, you should be able to actually have an emergency operation center which can be activated within about 24 to 48 hours. For workforce development, which all of you are part of, one of the most important things is that there should be a minimum of 1 trained field epidemiologist per 200,000. So you can see that there are metrics associated with each and every one of these action packages, which basically gives the people in the country, the public health experts in the country, as well as the policymakers in the country, a goal that they are actually supposed to achieve. So how does FETP fit in? Of course, Field Epidemiology Program is one of the most critical training programs within the Ministries of Health, which is helpful in training, having a well-trained workforce to be able to prevent, detect, and respond to these infectious disease events, as well as also some of the other areas which are in the non-communicable diseases, which I know that this conference also covers. But the Global Health Security Agenda is primarily focused on the infectious diseases. So the target related to the Workforce Development Action Package is that a workforce which includes physicians, veterinarians, biostatisticians, laboratory scientists who can systematically cooperate to meet relevant international health regulations and performance of veterinary services, or PVS core competencies. And then there are action packages and targets which are which can be measured against that particular target, like for 1 per 200,000 field population trained, 1 per 200,000 epidemiologists trained, and then about 1 trained veterinarian per 400,000 animal units. So it is a big, tall order to actually have 1 per 200,000 field epidemiologists trained. This slide basically shows that, at the rate, in terms of having that many epidemiologists trained, we would actually have to have about more than 30,000 epidemiologists at the intermediate as well as the advanced training level, which still would need to be trained. And when you look at EMRO region, there is still about 3,000 to 4,000 people that still would need to be trained in terms of the field epi training program. However, if you look at this map, this map basically shows various basic, intermediate, advanced field epi training program. It also talks about some of the surveillance training programs which have been occurring around the globe as supported by the Centers for Disease Control and Prevention, working with the Ministries of Health. One of the things which is really good about this region is that this region actually has the pride or the honor of actually having a lot of very well-functioning field epi training programs. For instance, the field epi training program in Jordan, field epi training program in Saudi Arabia, Egypt, Morocco, Yemen, it's Pakistan, Afghanistan. So there are a lot of very mature field epi training programs, and then there are field epi training programs which are, nascent, but they are the ones where the other field epi training programs can actually help them. And that is where the Eastern Mediterranean Public Health Network has been playing a critical role in basically bringing all the field epi training programs to actually work in coordination with one another and also being able to respond to the infectious disease events. I'm just going to quickly go through a few more slides, like 2 or 3 slides, where recently, as part of the Ebola response, the field epi training programs around the globe, not only from this region but also from the Afro region, they've been very helpful in sort of setting up of surveillance training for Ebola preparedness to improve the skills of the local public health workers in basic data collection and analysis, improving the quality and use of the surveillance data, and then they have also been able to improve the readiness of the frontline staff to participate in contact identification and tracing. There were response teams, which were composed of FATP graduates from all these countries in Africa. Now, I have not listed all the countries. I know that there were countries from the Eastern Mediterranean region, which actually also helped with the response. There were teams which were deployed to Guinea, Sierra Leone, and Liberia. And then there were a lot of graduates who actually also worked on the international teams as well as national teams and were part of the multidisciplinary teams as part of this huge. So as you have heard that, initially when Ebola was spreading, Ebola actually, there was a case which was identified in Nigeria. So if any one of you who's been to Nigeria, it's a very populous country, and in Lagos, which is a highly populous city, this could have been a big disaster in terms of actually the spread. However, at the same point in time, there were well-trained field epidemiologists who were already working on the polio eradication efforts in the country. There were emergency management and operation centers which were already established in the country and were well-functioning. And that infrastructure proved to be critical in actually helping stop the transmission of Ebola in Nigeria. There were, as a result of the work that the field epi training program residents as well as graduates actually helped in, as part of the infrastructure which was already built over there. They identified close to about 900 contacts. They completed nearly 19,000 contact tracing visits. That's a lot of work. They implemented a social mobilization strategy that reached out to about 26,000 households. And they also were able to establish an Ebola treatment unit in just 2 weeks. And as a result of that, Nigeria was declared as Ebola-free. And this is a great success story in battling the Ebola outbreak in a country where if there was no well-trained workforce, or if there wasn't a way to be able to respond in a coordinated fashion, it could actually have caused a lot more deaths and a lot more lives lost as well as economic loss to the country. Recently, the residents have also been helping with the Stop Transmission of Polio program, which was established in 1999. It's a partnership between CDC, WHO, UNICEF, and Rotary International. And between August of 2012 to July of 2013, over 5,100 remote settlements were identified in Nigeria with about 63,000 children. And Nigeria is very, very close to the eradication. There have not been recent cases of polio which have been, detected over there. The NSTOP program is also playing a critical role in both in Pakistan and Afghanistan. And again, that also highlights the importance of the field epi training program. So the question is, why does this work? This is because of all of you, and you are here, and your commitment, and the commitment of your mentors and leaders who are actually in the first couple of rows over here. There's very good cultural understanding for the region. There is obviously no dearth of technical expertise. There is a standardized curriculum, which might be translated in different languages, but that's how field epi training program works. And there's understanding of challenges, and there are long-term country commitments through the Ministry of Health. So the field epi training program and the workforce development is a very critical part of the global health security agenda as we move forward to achieve it, and also, in turn, also achieve the international health regulations. Thank you very much.
التي تواجه الصحة العامة. كما أن مشاركة ما يقارب 200 شخصا من الأكاديميين والخبراء من مختلف دول الإقليم، بالإضافة إلى نخبة من الخبراء وممثلين عن المنظمات الدولية العاملة في مجالات الصحة العامة، هي إثراء لمخرجات هذا المؤتمر، حيث تلتقي المؤسسة الأكاديمية التي تعتبر بيتا للخبرة مع المؤسسة البحثية إلى جانب مؤسسة تقديم الخدمة العلاجية في صورة تكاملية للجهود المشتركة الساعية إلى الارتقاء المقدمة للمواطنين. وإن تبادل الآراء والخبرات بينكم هو أحد الأهداف للوصول إلى فرص ثمينة لمواجهة التحديات. أيتها السيدات والسادة، إننا في الأردن إذ نفخر بما حققناه من إنجازات على صعيد الطب الوقائي، سواء من خلال التطعيم للأمراض المدرجة ضمن برنامج تطعيم الوطني والبالغة 11 مرضا، أو من خلال رفع الوعي للفرد والمجتمع الذي ساهم من خلال برامج التوعية والتنسيق التي ساهمت بإنتاج سلوكيات وممارسات صحية، إضافة إلى أنشطة الإصحاح البيئي التي تساهم في الحد من كسر حلقة اكتمال العدوى لكثير من الأمراض السارية، مشيرا إلى أن الأردن قد تبنى برنامج الوبائيات التطبيقي الأردني منذ 17 عاما، وتخرج منه 60 طبيبا يعملون في مديريات الصحة المنتشرة في جميع أنحاء الأردن، ويسهمون في استقصاء الوبائيات الميدانية ذات العلاقة بالأمراض السارية والغير سارية بما فيها التسممات الغذائية. كما يسعدني أن أشير هنا إلى أن الأردن من الدول القليلة في المنطقة التي تلبي إحدى متطلبات اللوائح الصحية الدولية بتوفير اختصاص وبائيات لكل 200,000 شخص. كما تخرج من هذا البرنامج أطباء من العراق واليمن وفلسطين وسوريا، فأصبح برنامجا إقليميا في المنطقة. كما ساهم وبالتعاون مع الشبكة الشرق الأوسطية للصحة المجتمعية والمركز الأمريكي للسيطرة على الأمراض على إنشاء برامج مماثلة في العراق واليمن، وكانت له مساهمات كبيرة في احتواء الأوبئة والجوائح العالمية مثل إنفلونزا H1N1 وإنفلونزا الطيور، مثل ما يساهم اليوم في مواجهة حالات وبائية ناجمة عن فيروس الكورونا. وأود أن أشير في هذا السياق إلى أن اختيار الأردن لعقد هذا المؤتمر جاء نتيجة لتميزه بخبرات ناجحة باحتواء الأوبئة والجوائح العالمية، وبالتنسيق التام مع المنظمات الدولية بقيادة وزارة الصحة ولجانها الوطنية الفنية المتخصصة. ومن الجدير بالذكر إن الأردن من أوائل الدول التي وقعت على اتفاقية منظمة الصحة العالمية الخاصة باللوائح الصحية الدولية، والتي تؤكد على الإبلاغ عن الأوبئة التي تشكل خطرا على الصحة العامة. وفي الختام أتوجه بالشكر الجزيل لكل من ساهم في الإعداد والتحضير لعقد هذا المؤتمر والمساهمة في إنجاح أعماله. أتمنى لمؤتمركم التوفيق والنجاح وتحقيق الأهداف المرجوة لخدمة الإنسانية. حفظ الله الأردن بلدا عزيزا منيعا تحت ظل الراية الهاشمية بقيادة جلالة الملك عبد الله المعظم، حفظه الله ورعاه، والسلام عليكم ورحمة الله وبركاته.
Thank you, Dr. Latoum, very much. Although Aqaba is the only coastal city in Jordan, it is at the important trade junction between Asia and Africa. The Aqaba Special Economic Zone Authority is responsible for the management, regulation, and development of existing and potential businesses. Most notably, this authority is committed to open governance. It is my great pleasure to invite Mr. Shirhabil Madi to speak on behalf of the Chief Commissioner of Aqaba Special Economic Zone Authority. Please give a big applause to Mr. Shirhabil Madi.
Bismillah ar-Rahman ar-Rahim. Excellencies, distinguished delegates, ladies and gentlemen. It gives me great pleasure to extend to you all a very warm welcome on behalf of the Aqaba Special Economic Zone Authority, and to say how grateful we are to your fourth EMPHNET regional conference here in Aqaba. It's an opportune time to renew contacts and discuss problems of all mutual interest with delegates from member countries of the region. It's gratifying to note that the agenda of seminar covers a wide range of very interesting items relating to the great opportunity for field epidemiologists and public health professionals to exchange experience. As I see, it's an important platform for maximizing skills among field epidemiologists working to serve their countries that will bring the work of many fields epidemiology training program, residents and graduate into spotlight. This year, we are expecting from this conference, public health in region, challenges and opportunity, to draw in several issues that are of common concern to the Eastern Mediterranean region, while also pinning down those difficult and typical situations that exclusively challenge some of its countries. We are expecting great opportunity for the local community in Aqaba and Jordan at large that will provide a chance for us all to promote Aqaba and all the touristic and economic opportunity it provides to a regional audience. Also, we are expecting from the local and regional media to bring great for participants and sponsored alike. Key figures will be present, thus providing chances for meetings for your business development and the promotion of Aqaba, thus providing great exposure for one-on-one interviews for key figures and other specialists. We are aware of a great opportunity for field epidemiologists and public health professionals to exchange experience. It's an important platform for maximizing skills among field epidemiologists working to serve their countries, as it brings the work of many field epidemiology training program, residents and graduate into the spotlight, and the large investment in funds and scientific effort by a number of member countries in reclaiming large areas of professionals to exchange experience. We wish them every success in their noble endeavors to develop their skills resources. It has become commonplace to say and repeat saying that security of health is the most severe constraint to the inputs of medical development. Yet this fact prevails. In concluding, I wish you very success in your conference and wish you a pleasant stay in Aqaba and welcome, and we really welcome the Ministry of Health and other ministries to do their conference in Aqaba as a nice tourism destination in the Red Sea. Thank you and wish you all the best.
Thank you, Mr. Madi. At this time, I would like to share with you a brief video featuring the work we do at EMPHNET and in collaboration with national and international organizations. I hope you enjoy the video. EMPHNET at a glance. The Eastern Mediterranean region embraces 22 countries that can be generally characterized by demographic transition, epidemiological transition, socioeconomic change, political turmoil, and migration. Recently, many of these countries witnessed severe disturbances and political unrest or war that affected the health status and population demographics of the region. Unfortunately, the Eastern Mediterranean region became home to the Syrian crisis and struggles in Yemen, Iraq, and Afghanistan. Such situations impede development and affect the health, well-being, and the demographic distribution of the countries. As a regional public health network, EMPHNET aspires to assist countries in strengthening their public health systems by providing opportunities to advance applied epidemiology and public health. In the year 2008, a meeting was held during a global conference for the training programs in epidemiology and public health interventions network, EMPHNET. The meeting brought together directors of field epidemiology training programs in Saudi Arabia, Egypt, and Jordan. They met with representatives from the Centers for Disease Control and Prevention. During this meeting, they discussed the need to establish a network that would facilitate and coordinate field epidemiology training program activities in the region. During a follow-up meeting held later that year, they agreed to establish a regional network with a consensus of having its headquarters in Amman. This is how EMPHNET was created. EMPHNET focuses on 4 key areas of public health. These areas are namely applied epidemiology and research, non-communicable diseases, communicable diseases, and health security. Within these areas, EMPHNET aspires to achieve better public health for people in the Eastern Mediterranean region. EMPHNET regularly works with 8 countries in the region: Saudi Arabia, Egypt, Iraq, Morocco, Jordan, Yemen, Pakistan, and Afghanistan. Recently, EMPHNET expands its umbrella to work with other countries from the region. Some of its key projects include the Mass Gathering Project in Iraq, which is a project that aims to reduce morbidity and mortality in Iraq mass gathering events. EMPHNET has also established itself as a training body in the Zaatari camp in Jordan, working in partnership with other health organizations to build capacities of public health officers working with the population of Syrian refugees residing there. In addition, EMPHNET has also made strides in raising the awareness of people in Ajloun in Jordan through its NCD project, which is designed to reduce the prevalence of non-communicable disease in that community. To improve surveillance, investigation, and response during outbreaks and disasters, EMPHNET launched a Rapid Response Team initiative, working to respond to the region's demand for rapid disease detection, investigation, and response. Recently, EMPHNET developed a roster of polio experts from the pool of human resources available at the regional level. Experts listed on the roster are to investigate and respond to polio outbreaks. To achieve its goals, EMPHNET regards capacity building as a key component to achieving better public health. It supports field epidemiology training programs and other public health officers and conducts training in topics ranging from scientific writing to Ebola rapid response teams training. It also attends and hosts conferences in an effort to provide opportunities for knowledge exchange and lessons learned from public health practitioners in the region.
For the future, EMPHNET sees itself utilizing the latest channels of information and communication technology to bring about higher levels of awareness amongst populations in the quest for community change. EMPHNET also sees itself as a linking hub contributing in responding to the needs of healthcare specialists as their countries require an organization diverse in its outlook and ready to respond to a full range of needs. EMPHNET values the partnerships it holds with ministries of health in many countries in the region. It acknowledges the support and collaboration with international organizations, the U.S. Centers for Disease Control and Prevention, the Biosecurity Engagement Program implemented by the U.S. Department of State Bureau of International Security, and Non-Proliferation Office of Cooperative Threat Reduction, World Health Organization, the Training Programs in Epidemiology and Public Health Interventions Network, and all other entities it works with. Without such collaborations, EMPHNET would not be where it is today. It is also proud of the monumental work and engagement of the public health programs, as it is through this collaborative effort that the region will see higher public health standards for its communities.
I hope you enjoyed the video. We thank Aqaba Special Economic Zone Authority, Hikma Pharmaceutical Company, and MSD for their great support. For your constant contribution and support, ladies and gentlemen, we thank you and welcome you with gratitude and optimism to Jordan. Now please join us for the welcome reception outside in the garden. الآن تفضلوا الحديقة لحفل الاستقبال.